Canadians have seen countless news stories about our healthcare system struggling to meet demands. People just aren't getting the care that they need. And consequently, Canadians are now more open-minded to drastic changes to our healthcare system than we've been in decades. A new poll conducted by Global News Ipsos shows that a vast majority of Canadians, 85% who were surveyed, would like to see drastic changes to the system in order to help their communities. Now, what does drastic change mean? That's the natural question to ask. And of course, change means something different to different people. In Ontario, we've seen Premier Doug Ford introduce an expansion of the services and procedures that can be provided by private health clinics. Of course, those private health clinics still receive public dollars to do those services and procedures. A majority of Canadians seem to be on Premier Ford's side. They seem to think this is a good idea. That very same Global News Ipsos poll showed between January 19th and January 23rd, 2023, 59% of the 1,001 adults surveyed expressed support for the private delivery of publicly funded health services. Global News also notes that the poll shows 60% of respondents were in favor of private health care for those who can afford it. It's a pretty big change in Canadian thinking, Canadian culture, Canadian politics. Now, perhaps surprisingly, the province with the most support for healthcare privatization is Quebec. And the demographic group most interested in privatization are Zoomers and Millennials, Canadians aged 18 to 34. Of course, not everybody surveyed is supportive of healthcare privatization. The age group most resistant to these drastic changes are Canadians 55 years and older, which makes perfect sense. That's the age group that interacts with the healthcare system today more than anyone else. They're most dependent on the system we have. Their lives would be most affected and upended by any drastic changes. As a cancer patient myself, I can relate to that. I can understand the fear that a Canadian might feel when told that there's going to be a big change to healthcare. If you're seeing a doctor every week, every month, what does it mean for you? Does it mean that you're not going to get to see the doctor you trust anymore? Does it mean that the things you don't currently have to pay for, you might have to pay for down the road? Those are real concerns. Now, when we talk about these issues in politics and media, it becomes very ideological about policies and parties and ideas. But the truth is, for most people that I know, the people I see in cancer wards, the people I see in hospitals, it's not about ideology. They want to live, and they want to be healthy, and they want guarantees that no matter how much money they make, they're going to get the care that they deserve. So when we talk about making drastic changes, we've also got to talk about how that's going to be paid for. This week, Canada's premiers are getting together from all across the country to meet with Prime Minister Justin Trudeau. And the topic of conversation is federal healthcare transfers. How much money is the federal government willing to put up to increase provincial healthcare budgets? And this is a very important conversation because if they're going to talk about drastic changes to the healthcare system, they've also got to talk about how they're going to pay for it. That's the only way that they can signal that these changes are not about just helping the wealthy and well-connected, but the changes have the average middle-class Canadian family in mind. This is an opportunity for the premiers and the prime minister, our political leaders, to show us how serious they are about change, but also how serious they are about paying for it.